All right. Good night, everybody. It is 8:30 Central Time here in Texas. Let me know where you all are joining from. This is another Thursday Night Live Facebook of Hot Topics in Healthcare and Healthcare Hot Topics. As some of you may be new to my page here, my name is Jen. I am a nurse with 20 plus years experience in nursing, with a wide range of experience, from utilization review to psychiatric nursing, pediatric home health care for children with special needs, oncology, geriatric care, just a wide range of nursing experience, and also employee health and occupational health, which is the type of nursing that I do right now, which entails a whole bunch of things that there will be another video on that of a day in the life of what an employee health nurse, occupational health nurse does. So for tonight, just let me know how hot it is where you're from. Here in Texas, it's really hot, but with like the AC, it's like really. So yeah, I have wearing a long sleeve shirt here in my office because it's super cold and chilly. But then if I go out there, then burning up hot. So right now, like some of my friends right now, depending where they live, California, Nevada, they are in the triple digits. We're not in the triple digits, but it was still hot. It was still like high 90s today. So a few of the topics tonight that I wanted to talk about briefly is how to advocate for yourself in healthcare. Sorry, I just tried to fix the video here. Especially if you're needing a second opinion on something when it comes to your healthcare, because sometimes insurance doesn't pay for that second opinion. So different ways of going about that and advocating for yourself with that. If you feel that you're not getting the help that you're needed, you really want to advocate for yourself because you know your body the best, and really getting the care that you need. A lot of times people do get frustrated with the healthcare system, myself included, of, oh, I went to this doctor and they sent me to another one. And that's because a lot of healthcare professionals say you're a primary care doctor. You have some knowledge in cardiology, endocrinology, but you're not the expert. You may be, the expert in family medicine or pediatrics. However, if it's, oncology, neurology, you're going to be referred to the experts. And it's not to say that family doctors don't know anything. No, they absolutely do know all the basics, but there's a certain time where something is out of their scope, and no, it's not them afraid of getting sued or anything like that. Is they're doing their due diligence, and they know that there's a certain time, okay, I really can't help this person with this over here. My family doctor did that to me with my migraines, of finding me a neurologist that could help me, and we eventually found one. However, with finding a neurologist that would actually listen to me, I had to go through several different neurologists until we actually found a treatment plan that was working for me, that did include me being on medicines that would make me drowsy, that would take me away from my work, because I wanted to work. And I know some people, the pain, you know, like myself, can get so bad at times, like it's really hard to work. And I was like, no, I want to work. So there are certain medications that make me drowsy, just couldn't be on. And we eventually found a treatment plan. However, that treatment plan took me advocating for myself a lot. It did not happen overnight. It did not happen in one appointment. It was actually a process of probably several months to find the right plan. And I know some people are get frustrated because we don't want to be in pain and we want to feel better right now. And unfortunately, sometimes it's a process and it sucks and it takes a while. I just want to encourage you, don't give up and, you know, don't stop fighting for getting the healthcare you need. And within that process, one of the other things was finding the right doctor is the right fit for me. Now, for specialists, I will say that a lot of the specialists, such as neurology, you know, cardiology, a lot of times there is a huge wait list to get in. Especially also for psychiatrists, there is a huge wait list. So in the meantime, your family doctors are trying to do the best they can, and they're not experts in, you know, psychiatric mental health, but they want to do what's best and keep people on medication until they can get into that specialist. And especially something that maybe be a little bit more care would be especially finding the right psychiatrist. I know for myself, when it came with neurologists, there was one neurologist I actually fired because of their attitude, their horrible bedside manner. And I would go to anybody else in the group after the interaction I had with that physician, neurologist. I was like, nope, not going to him. And you do have that right as a patient. There's a respectful way to do it. You just can't say, get the F out of my room, you know, nothing like that. However, if you need a second opinion or a different doctor, you really need to work with your insurance company. A lot of people won't make the call, and unfortunately, they'll use apps like ZocDoc or Doctors on Demand. Some of those are good apps at time. However, they might not always take your insurance. Just because they say they take your insurance doesn't actually mean that it's in network. It just means they're going to take your insurance card. So to prevent, you know, that surprise bill, that surprise copay, make sure you're getting a list of doctors that are in plan from your insurance company. You can call them. They will give you, usually email you a list of doctors. And you can say, hey, I need a list of doctors in this area that are accepting new patients. Usually they email you that out 2 to 3 business days. They do it if you ask them nicely. I know because I do this all the time, and I just did it. And especially also, I know with mental health, it is really hard to find a good psychiatrist, a good therapist, and that is something that does, you know, sometimes take more care. However, I highly encourage people who are needing professional help to seek it with a counselor, a psychiatrist. There are programs such as the Employee Assistant Program where you work or where your spouse works. They usually cover anywhere from like 3 to 8 appointments, and then they will work on finding you. Sometimes those counselors from the EAP, they can't prescribe medicine, but they can work with you to find a psychiatrist in your area. And this is where I say, you know, it's kind of like with different teachings, take what you like and leave the rest. It is going to be hard. It is hard to find a good psychiatrist and counselor. They are out there, but the first time you go, it might not be a match. It's like dating. It is like finding the right church. All those things. It takes time and effort. And I know, unfortunately, this is where people give up because they're tired. They don't want to make the calls, the anxiety of making the calls, all the things. But you are fighting for your care and for that healing process to begin. So make sure that if you go to a counselor and it's not a good fit, you get another one. I've, had this happen. Actually, just recently, I use our own EAP services. It was, and I had to advocate to tell them that their process was really messed up. And I was like, I tell people to use this. You guys aren't user friendly, because I kind of wanted to try the process to see what it was like. And I was like, okay, this process is just a hot mess. How can I make it better for the nurses that I work with and other healthcare professionals that I work with on a day-to-day basis? If nobody knows there's a problem, how can they fix it? So we are working to address some of these issues. And however, I had one just to see the process, and it was like, they're like, download this app. I was like, okay, fine. Used it, used whatever app before. Fine, signed all the paperwork in there, all the online things. And then they're like, oh, now you need to download this other app. Now you need to, fill out all this other paperwork. And I was like, no. If somebody's really struggling, that's the last thing that they need is one more barrier, one more thing to stop them from seeking treatment. So yes, our healthcare system is a mess. That is why I do what I do, is to make it better. I could have left healthcare, nursing a long time ago, still have the choice to walk away from it at any moment in time. However, as somebody that has this many years of nursing experience, there is still a lot of good, and I want to make it better. And right now, I do have the opportunity to have a seat at the table to make it better, to be able to openly speak at different meetings where it has our, CEO staff, all those C-suite, suit people, C-suite people, and be able to tell them what's really going on and doing it in a very, very respectful way. The other thing is, I want to mention, because some people here on my Facebook page are colleagues, friends from nursing school, friends in the medical community and nursing. However, a lot of my friends do not work in the medical field, and that's okay. I love you all. So sometimes there's a big difference, and some people may not realize just because somebody works in the healthcare profession does not mean that they have the same knowledge and scope of practice. And what I mean by that is that just because somebody wears scrubs does not mean that they have a medical background. Hospital where I work is our supply chain people wear scrubs because they're delivering all the supplies. They know about supply chain. They can tell me what N95 masks are in stock, and what ones we should be using and which ones I need to be using up. That's fine, but they don't know what solution goes in what bottle to do the fit testing. They know I need the solution, but they couldn't say this solution goes in this bottle, this solution, and this is how you do the test. That's not their background. Their background is logistics and keeping us happy with the supplies we need to do our jobs. And just like our housekeeping wear scrubs, and they keep the rooms clean, and they're like our front line of infection control by keeping the rooms clean. So just because somebody is wearing scrubs doesn't mean that they're automatically a nurse, automatically a doctor, automatically know what they are talking about in healthcare. So just don't assume because somebody's wearing scrubs or you see somebody with a stethoscope around their neck that they are actually a true healthcare provider. Because there's a lot of people, unfortunately, in this day and age that want to fake their experience, want to fake what they know for, likes, whatever, followers. However, I do have 20 years experience and I have evidence of that. So my degree is somewhere. But also there's different levels of knowledge in healthcare where CNAs, home health aides, they only have really about 2.5 weeks, 3 weeks of training, if that. Where nursing homes do require, most states require that you have state tested nurses aide, so certified nurses assistant, where they go to have class. It's like a 2.5 week to 3 week program. Whereas for other healthcare providers, LPN, LVN, depending on your program, it can be anywhere actually from 10 months to 1.5 years, depending if you're getting IV certification with that. If you're getting LPN to a degree, which may not be in nursing because LPN, LVN is not a degree, it is a diploma program. You do still take a state board and your scope of practice is different than what it is of a registered nurse. Even for registered nurses, you can have somebody that has an associate's degree, an associate's applied science degree in nursing. So they'll call it like an AD associate's degree. There's different ways that they say that. And also there is then a BSN that has associate's degree is usually 2 to 3 years of school. BSN is usually 4 to 5, and with that, because still going off, 4 to 5 years. That is because if you have prerequisites or don't have prerequisites, then you can get a master's, nurse practitioner, doctorate all the way up. And even some nurse practitioners and those that have a PhD, some of those are in education. So a lot of them may not really have had any true bedside experience, except for their clinicals where they had to do the clinical training where you basically pay to work for free. Basically, that's what it is. And then you go on, and a lot of them then go straight into master's programs, which is great in academia, where then they're really away from the day-to-day bedside nursing of really, what's going on at the bedside. And even there are people that don't maybe have medical knowledge of how to look at their statement, of their insurance statement, of knowing, things like what is their deductible, what is their copay, is something in network, because those are all things you want to know before you make a doctor's appointment. Is where you at with your deductible? What's the copay? Are they in double checking that they're in network? And that's from anything from lab, X-ray, MRI, to dental, vision, any specialty, even using urgent care centers. Where we're at, there's a couple, many, many different urgent care centers. Where I work, there is one you need to use. And if you use that, I think actually our copay is $25. which is cheaper than me to actually go to an office visit at my doctor's office, which is $40 for a copay. So I was like, okay, make this make sense. But knowing what your plan covers, because a lot of people don't, even nurses, things like how to read your bill, how to advocate for yourself, how if a medical bill, or an authorization gets denied, what you can do for it. Because a lot of people honestly don't know. They don't know what their rights are between that. And there is differences also between what a billing person does, who works in billing, or the medical office or reception in a doctor's office. Unit clerks, there's also a huge difference between billing, where people just send out the bills, and the coders who actually put the ICD-10 codes on those bills. It's a different level of education. It's two different things. And then you have a group of nurses that also review those codes. But then you also, on top of that, have, when you go through the whole authorization process, of nurses reviewing that to see if it meets criteria. And also, nurses don't deny anything. I know a lot of people say, oh, nurses are the one that deny treatment or this. It is not nurses. And so that's an assumption a lot of people make. And so I'll be doing a video about that in that whole process. If you guys want me to, just let me know. Because I do have many years experience in that part of nursing as well. So if you have any questions for me, let me know. And I will see you next week, and stay nice and cool. I love you guys so much. See you next week.